Hi, welcome to the video diary again. It's been a couple of days since I've been on here, so I do apologize for that. I just didn't get a chance yesterday to get the video done. So um, it's been pretty steady. Weather's great in Melbourne, so nice bit of warmth. I think is keeping everyone pretty happy. One thing we sort of just warning to people: horses that are prone to laminitis. We've had a little bit of heat again. We've had some moisture in the ground. We're starting to get some green shoots come up. You need to be very aware of that. It can be a bit of a problem at this time of year, a flare up of laminitis, especially the Cushings horses. We get a bit of flare. So ACTH testing, which we do for laminitis. So ACTH, we take a resting level. We're pretty comfortable 90% of the year with the results that we get. But if you get an abnormal result in autumn, that can be a little bit, you have to double check that again, because some of them can be abnormal in autumn and they have a higher reference range in the autumn time. So normal reference range for ACTH, which is the simple blood test, is less than sort of 27 is pretty much normal. But above that there, we're looking at Cushingoid horses. But in the autumn, we actually change that reference range to 57. So a lot of normal horses will have an elevated rate. So just something to be aware, the horses that are on Cushing's medication, so that's pergolide, you may need to increase the dose at this time of year. So last few days, we've just been following up a few cases, a few limbs issues. One client, unfortunately, had a horse with a tendon injury. It's just disappointing, but unfortunately, that's just part of it. So we scanned that there. It's got a nice core lesion in the center of the tendon. And often, the other thing, say, sometimes you find is that if you've got heat and pain on a tendon, we'll often give it a day or two before we scan it, because sometimes you scan too early, you can actually miss the extent of the lesion. So we allowed this to settle for a couple of days. So the basic management to start with is ice and anti-inflammatories, so such as bute, and then icing the leg twice a day, some support bandages just to try and get the inflammation out of the leg is a great way to start and do that there. And then a couple of days later, we come along and we scan the tendon, clip, have a good look and see what the extent of the injury is. We find that a lot better way than scanning too early. If you scan early, you can miss lesions because they do get worse over the next couple of days. So did that there, and then followed up in an interesting case, a race horse that's got a carpal canal issue. So it's not actually the knee joint, it's at the back of the knee. That bone that you feel at the back of your horse's knee, that's the accessory carpal bone, and around there's all the tendons and ligaments that run through that canal, and you can get some problems in there that cause sort of abrasions on the tendons. Sometimes you can get a little fragment of bone in the back of the knee that can cause inflammation. So this horse has an interesting blocking pattern. It blocks sometimes the middle carpal joint of the knee, other times it doesn't. And when you put local anesthetic in the sheath, you do actually get a very positive result. So this horse, we'd ultrasounded it previously, seen a little fragment of bone, so we've put some cortisone in there and hopefully it responds the next couple of days. And then just a few shockwave treatments the last couple of days, following up on cases. So all in all, it's been pretty steady the last couple of days. Great weather, enjoying it. So catch you soon. Talk to you tomorrow. Bye.